psychiatry, right? When you're thinking about a psychiatrist, that's often associated with a person who can prescribe medication versus often therapy. And a therapist is often someone who is very well-versed and well-trained in the art of different modalities of therapy, but they may not necessarily be able to prescribe medication. So it's really important for patients to understand once they finally make the decision that they're like, you know what, I want to get on top of my mental health. You know, I really feel like I need treatment. I feel like I need to talk to someone. Understanding who that someone is and what that someone can do for you and what they can't do. So psychiatry, right? When you're thinking about a psychiatrist, that's often associated with a person who can prescribe medication versus often therapy. And a therapist is often someone who is very well-versed and well-trained in the art of different modalities of therapy, but they may not necessarily be able to prescribe medication. The unique thing about board-certified psychiatric mental health nurse practitioners like myself is we are not only trained, but we are licensed to do both. We can do therapy and we can also prescribe medication. So medication and therapy together are really, really important. A lot of times when patients come in, they're in such a state, they're in such a position that they just want something to help, and they just want something to help right now. And often medication in their mind at that time may feel like a quick fix, like, give me something, I need it to be something that works like Tylenol. Within the next hour, I need to be feeling better. I need to be knowing that I'm headed in the right direction, which is good. That's great, and several of our medications can definitely, work quickly. But the whole point really of medication often is to get you as the patient to a certain point where then you can benefit from the therapy. So I almost think of medication almost like the gasoline that you put in the car. We're not just putting gas in the car so that the car could just sit there. Now that you have the gas in the car, what are you going to do with it? Where are you going to go? Once you're gassed up, you can go anywhere. So now that we get the right medication on board, we've got you, medicated, you're not so anxious, you're not dealing with the insomnia, you're sleeping much better, you're not experiencing, psychosis, hearing things, seeing things for some of the diagnoses that are, a little more serious, not dealing with the depression, the anhedonia, which is just, a big fancy word for just being, down and not having any, emotion and not feeling anything and not wanting to go anywhere or do anything, not really getting enjoyment out of the things that you used to get enjoyment out of. Now that the medication has kind of treated that, now is when we can kind of get to the bottom of like, all right, now I'm coming up for air. When did all of this start? When did I start to become depressed? When did this anxiety start? What are some triggers in my current environment, in my day-to-day life? What triggers me kind of going back to being anxious, kind of going, going into a manic episode, or back to being depressed, or being socially, not wanting to socialize with people, kind of wanting to be by myself and be on my own. Once you get that medication in there and you get yourself in that frame of mind where now you can go back and kind of survey the landscape so that as you move forward, it's like, you know what? I've learned that when I'm really stressed, it triggers my anxiety. It makes it that much harder for me to manage my symptoms of ADHD. It causes insomnia. Then I'm not eating the way I need to. It becomes a trickle-down effect where it starts to affect many other areas of your life, including your personal life, your personal relationships, your romantic relationships, your relationships at work, how you're doing at work. All of them start to get affected. So for a lot of people, for most people, it's not enough to just do the medication piece and not do the therapy piece. So back to kind of knowing who to go to for what. So for instance, like I said, board certified psychiatric mental health nurse practitioner, we're licensed to do both therapy as well as prescribe medication. Psychiatrists, same thing. They're licensed and they're trained to do medication management as well as diagnosis, as well as therapy. Often what happens, because we don't have enough providers that are trained and licensed to medicate, the ones that are licensed and trained to medicate decide to just focus on medication management so that the other people who are trained in the modalities of therapy can focus on that. I practice in a way where I do a little bit of both because I find that it helps to do a little bit of both. It helps me to get to know my patient a little better. It helps me as the prescriber often to be able to assess how well this patient is really doing with this medication and with this treatment. You know, how well is it going? How effective is it for them? So I do a little bit of both. But there are some providers where they just strictly do med management, and then they will refer you out to a therapist for all different types of therapy. There's talk therapy, there's EMDR, there's CBT therapy, there's DBT, right? So there's all different types of therapy. So often having this conversation right off the bat with your provider, hey, this is my first time doing this. I'm not sure if I'm here seeing the right patient, the right person for this. I'm really looking for therapy. I'm not really interested in medication management. Have that conversation very early on when you're meeting with your provider. That way you both have an understanding of what you're looking for and what you're looking to do. That's usually how I start off all of my conversations with my patients is, hey, welcome to Augustin Psychiatric Associates. What brings you to see me today? And usually what they tell me kind of gives me some insight into what they're looking for. And if they don't state it, I'll just ask right out. Like, okay, are you looking just for medication management? Are you looking for diagnosis? Are you looking for therapy? And sometimes they're not sure, and that's okay too. So here at Augustin Psychiatric Associates, whatever you're looking for, we can handle. And if we can't handle it, we at least are coupled with many other providers in the community that we can refer you to, that we partner with, so that it's not just like, yep, nope, we don't do that, don't know what to tell you. We at least try to steer you in the right direction.